our first seminar in a series of monthly seminars that we're providing here at the Institute. Louisa Ells is our Professor of Obesity and Co-Director, and she'll be speaking today about people at the heart of obesity research. Just a point to make that our seminar series covers a broad range of areas. We won't just be focusing on research. We'll also have topics that cover methods and some of our teaching and training as well. So information on all of that can be available on our website and through the same Eventbrite information that you received to get here today. So it's with a pleasure I introduce and invite Louisa. Over to you, Louisa.
Thanks, Ada, and honestly, it's such a great pleasure to be able to open the new series of seminars about on an area that I'm really hugely passionate about, and also it completely underpins our approach within the Institute as well, and that is people at the heart of obesity research. So if we can pop on to the next slide, please. I'd really like to start by sharing with you a short film. It's a really super short film, and I just really like it because it really illustrates the power of lived experience.
So an average morning for me would be waking up in bed. After lying overnight, I have aches and pains, especially in my lower back. The thought of having to get out of bed is a struggle.
When I'm traveling with public transport to my work, I usually feel that I am judged.
At work, they don't know my name. They all know me only as the fat construction manager.
People notice you and they stare.
Society, they're going to give stigma no matter what. If you're not looking like this perfect person as they see on Instagram, we not all look like each other.
It's all day, every day. And then you wake up the next morning and it starts again.
I love to cycle.
I love swimming. My life is swimming. I teach swimming.
Painting. It's my new hobby, and I paint like a 6-year-old. I draw like a 6-year-old, but I'm having so much fun with it. I love it.
I'd love to see people change their judgments, to just take 1 second to pause before you speak.
People, if they were educated and understood what obesity was, perhaps maybe they wouldn't judge and shame people and they'd support them instead.
Let's actually have an aligned language, one that's mutually respectful. It is a disease. I have obesity. I'm not an obese person.
It's a lovely film produced by a number of colleagues, including the European Association for the Study of Obesity, and it's just a really lovely film that really kind of illustrates the power of the voice of the lived experience, but also really illustrates the importance of language. And if we pop on to the next slide, please. That's grand. Yeah, so it was a kind of nice introduction into the importance of language, because language really does matter if we're really going to tackle stigma and undertake a truly person-centered, compassionate approach to our research in order to make a real and tangible difference to the lives of people living with obesity. At the Obesity Institute, we're therefore really passionate advocates of person-first language and tackling weight bias and stigma, because unfortunately we know it exists within healthcare and research settings, and that negative attitudes about individuals with excess weight have been reported by a range of professionals, including physicians, nurses, dietitians, psychologists, and medical students. And we know that there's research that also shows that even those who specialise in obesity and weight management can also hold negative attitudes. It's absolutely critical, therefore, that this has to stop. And if any of you have seen the latest short film that we released on World Obesity Day, you'll know that at the Obesity Institute, we're absolutely committed to changing the way that we talk and also think about obesity. It's really critical that we acknowledge and also treat obesity as a chronic relapsing disease. It's not a lifestyle choice. So if you pop to the next slide, please. Oh, that's super. So in order to achieve this compassionate approach, I think it's absolutely critical that we're able to deliver person-centered care for people living with obesity. And last year I wrote a paper for Current Obesity Report. So in this slide here, I thought it'd just be useful to share some of the key considerations and actions that came out of that paper. So obviously at the heart of a person-centered approach is people and the person living with obesity who really need and want tailored care. So in order to be able to achieve this, firstly, we need to recognise the need for personalised and also coordinated care. So this is care that really considers the sort of social, cultural, emotional and environmental factors that can impact care. It's about recognising the need for coordinated multidisciplinary care, as often people living with obesity can have complex needs and suffer from multimorbidity, and we hear far too often how effective care has been inhibited by a real lack of joined up services. So it's really important that we acknowledge the need for changes and challenges to care in different settings, but also across different life course stages as well. So to enable person-centered care, we need to be providing flexible service specifications and joined up care pathways. We also need to enable care by supporting patients in using and interpreting accessible and appropriate information about their care. And this includes optimising the use and accessibility and also trust in digital health resources, and really acknowledging that patients and professional expectations may very well differ, but both are equally as important. So underpinning all of this is the critical importance of providing dignity, compassion and respect by eliminating stigmatisation and weight bias, always using person-first language and always asking permission before weight is actually discussed, and ensuring that all of the conversations we have are positive, helpful, supportive, collaborative and understanding. So there are some really great examples for anyone that's wishing to develop more of a person-centered approach. And my favourite is the Canadian 5 A's approach, which is a fantastic international framework for patient-centered and person-centered care. It's based on the principles of asking, assessing, advising, agreeing and assisting. It's a really compassionate approach that uses a whole person lens to really understand the complexity of obesity and also considering the wider context. It works through genuine collaboration and partnership between the professional and the patient, and importantly builds on the patient's own capacity, their strengths and their resilience. So if we could pop to the next slide, please. That's great, lovely. So Obesity really is a chronic disease that requires lifelong, personalised, person-centred care. And if we're to achieve this global move to a truly person-centred care approach, we really do require a paradigm shift in thinking and actions across the whole system, and a real need for innovation, for education, collaboration and co-production, which is really at the core of what the Obesity Institute was set up to achieve. So next slide, please. So our mission within the Institute is to work with people living with or at risk of obesity in order to co-develop innovative, person-centred advances in obesity locally, nationally and internationally in order to achieve one clear vision, and that is to improve the lives of people living with or at risk of obesity. So next slide, please. So in order to achieve this vision and mission, really the voice of lived experience is absolutely at the absolute heart of everything we do. Next slide, please. Therefore, public and patient involvement and engagement is really the foundation to the Obesity Institute, because it helps us to ensure all of the work that we do actually meets the needs of the patient and the public that we are serving. It enables us to undertake a truly person-centred approach, which is really driven by the voice of lived experience. And it also helps us to ensure our work is equitable, it's inclusive, by incorporating the voices of all populations, not just those that are most frequently heard. It also helps us to deliver research that is acceptable, appropriate and relevant to our research participants, and that our findings are also made useful to the public and patients through co-design of resources and sharing findings using appropriate communication methods. And lastly, it also provides an opportunity for our students to learn from the voice of lived experience, helping us to develop a new generation of truly compassionate and person-centred professionals. So if we could pop to the next slide, please. Super. So our vision around PPIE is really integral. And we see our PPIE members very much as partners that reflect the voices of the communities that we serve. We are really committed to working with people living with or at risk of obesity from across our broad and diverse populations in order to co-design, to shape and co-produce all of the research that we undertake, really strongly underpinned by our ethos of care, compassion, collaboration, equality and inclusion, with a commitment to really ensure we always use person-first language, and we will continue to work to eliminate stigma and bias. We're also working with our fantastic partners at Obesity UK and the Association for the Study of Obesity to provide Obesity Voices, which is our national PPIE hub. It's the first hub of its kind in the UK, so will be really critical in helping us to break new ground. Next slide, please. So in addition to our vision, we also have a core set of PPIE values, and these are respect, support, transparency, responsiveness, fairness of opportunity and accountability. Next slide, please. So to ensure we really remain true to our vision and values, we are privileged to be supported by a fantastic Obesity Voices steering group. This group represents the voice of lived experience from across fantastic members representing the European Coalition for People Living with Obesity, members from Obesity UK, the Obesity Empowerment Network and the Yorkshire Obesity Research Alliance. The committee is chaired by our fantastic PPIE lead, Ken Clare, and supported by our fantastic Institute consultant and coordinator, Sanit and Saida, without whom any of this would be possible. So next slide, please. So to support our members, we have a code of conduct and a rigorous partnership arrangement to ensure all of our trusted partners share our mission, our values and our code of conduct. We also have a welcome pack for all of our new members and a regular newsletter. So if you're interested in finding out more about Obesity Voices, I'd really encourage you to follow the Leeds Beckett Obesity Voices webpage or scan in the QR tag. So next slide, please. So what does Obesity Voices do? Well, at the moment, it's bringing together a community of over 250 members who bring a really diverse voice of lived experience. It helps us to develop and also to mentor our PPIE members, provides a forum to collect and share good PPIE practice. It provides advice and guidance on undertaking meaningful and effective PPIE. It provides PPIE training for researchers and also our PPIE members. We also signpost to existing PPIE training resources and provide a real sense of a PPIE community that's really dedicated to using the voice of lived experience to achieve the vision and mission of the Obesity Institute and our trusted partners who share this vision and mission with us. So next slide, please. So we're often asked what training we're currently in process of developing, and I know Ken will probably talk a little bit about this more in his session next month. But the training we're currently developing for our PPIE members includes training around traditional skills such as committee work, understanding evidence, advocacy, working with numbers, telling stories, and reaching least heard communities, and things like understanding ethics. Next slide, please. Because this also sits alongside newer training skills in things like social media, undertaking podcasts, developing web content, blogs, using new techniques such as photo voice, providing short films, and really thinking about and learning new techniques for advanced storytelling. Next slide, please. So what does the future hold for us? Well, we will hopefully continue to build our strong group of confident PPIE members across the UK, and will ensure that these members really underpin everything we do, very much adhering to our philosophy of nothing about us without us. It was also our ambition and aim last year to submit our first patient-led research bid to the NIHR, which I'm really delighted to say that we did successfully, and I'm even more delighted to say that we were awarded at Christmas, and that really exciting project will start in April. So if we could pop to the next slide, please. So as you can see here, PPIE really is the foundation to all of our research activity across the Institute, which focuses on three integrated research themes that examine systems approaches to obesity, tackling inequalities, and also improving weight management and well-being. So if you could pop to the next slide, please. So our research objectives are to build a strong portfolio of really highly applied research, to identify new research and collaboration opportunities, to support new funding applications. We also have established principles and values for the research that we support in order to ensure that all of our research is person-centred and provides real-world solutions to real-world problems that actually make a real and tangible difference to people's lives. We will continue to develop our Obesity Voices PPIE hub and ensure that PPIE really does underpin everything we do. We'll also try to identify any obstacles to effectively streamline our research support processes, develop a robust funding strategy, and importantly, build research income, and most importantly, have research impact. So if we could pop to the next slide, please. So in order to achieve this, care and compassion and collaboration and transparency are absolutely critical. So our cross-school collaboration is really important in bringing together the range of skills and expertise required to tackle the complexity of obesity, and compassion is central to our person-centred approach, with co-production with our policymakers and practice stakeholders critical to helping us to understand and respond to real-world needs. Therefore, transparency and governance are absolutely critical and underpin all of our research activity. So if we could pop to the next slide, please. So before I end, I just wanted to share with you a few snippets of our current research activity. So as I mentioned previously, at the top here, we have the really exciting grant that we're just about to start, which was our first patient-led grant that will be looking at developing and evaluating innovative, person-centred, tailored, peer-led Obesity UK support groups to provide support and improve research co-production with our least heard and underserved communities. My fantastic colleague, Professor Maria Maynard, is also leading a really exciting MRC grant where we're co-producing some community-based diet, physical activity and weight management interventions for UK Black and South Asian adults. We've also been really fortunate in securing another year's funding to run the fantastic Yorkshire Obesity Research Alliance. So this alliance brings together academics, policymakers, practitioners and people living with obesity in order to work together to really understand and develop effective solutions to the most pressing obesity priorities across Yorkshire. We're also collaborating on a number of really exciting NIHR projects and are hugely privileged to be leading the national evaluation of the NHS low-calorie diet programme. My colleagues also work within the systems work stream, are also leading some really fantastic local and also national evaluations of systems work. So if we could pop to the next slide, please. So in terms of what next, well, I'm delighted to say that Ken Clare, our PPIE lead, will be coming to talk to deliver the next seminar in this series, and he'll be talking about PPIE and the development of the Obesity Voices Hub in a little bit more detail, and that will be towards the end of April. We also have the Yorkshire Obesity Research Alliance. So this alliance actually works in partnership with the Regional Association for the Study of Obesity. We hold 4 seminars a year, and the next will actually be hosted by the ASO, and this will be on inequality and stigma in obesity research and care. And then we are also hoping to, or not hoping, we will be hosting 2 symposiums within the European Congress on Obesity in Dublin in May. So one of these we will be leading on looking at emotional and disordered eating in people living with obesity. The other will be looking at person-centred approaches to obesity care, and that will be led by our fantastic colleagues at Obesity Canada. So both sessions will hopefully have an option to join live if you're not at the conference. So watch this space and hopefully more details will be arising. So if we could pop to the next slide, please. That just really leaves me to say a huge thank you. It's been a great privilege to speak today, and I really look forward to receiving your questions.
Fantastic. Thanks, Louisa. I'm going to help with the questions this afternoon. We do have plenty of time for them. If anybody is interested in asking a question, we are using Slido. It's the same details as we used for the World Obesity Day event. So slido.com, and the event code is #LBU Obesity Institute, all one word. And whilst people think of their questions, I suppose I do have one, which I have been very keen to ask you in terms of, you know, it's been lovely working so closely with you and seeing how passionate you are about this person-centered approach. And as we've developed the Institute, there have been so many hurdles to go through in order to achieve that vision. How do you think that the landscape has changed towards that more person-centered approach?
I think we're definitely heading in the right direction. I think we've got a long way to go, but I think some of the fantastic work that Obesity Canada and colleagues in Canada around the development of that framework, and we're starting to see that introduced into sort of care within the UK and sort of wider global settings. So that's really positive. And in terms of actually integrating the voice of lived experience into research, I think that's really being helped by the positive push for within the funding councils to support a very genuine use of the voice of lived experience in terms of underpinning research development. So I think we've still got a way to go, but I think we're definitely moving in the right direction. And I've probably seen the biggest change and the biggest movement within the last couple of years. So I'm hoping we're on that upward trajectory.
Fantastic. And I guess whilst people are thinking of their question, I'm going to take the opportunity to ask some more. In terms of, because a lot of the sort of, I guess, classical PPI has always been in research, and within the Institute we have really put ourselves on quite a task of making sure it's all of our activity is underpinned by the lived experience. So how do you expect to achieve more of that lived experience across other activities?
Yeah, I mean, that's been really important because PPIE has also underpinned our knowledge exchange and our teaching activities. And I'd really love to see, I mean, PPIE is intrinsic to all of our research development, but it's absolutely been fantastic and fascinating to integrate it more within our teaching agendas. And I just think it really enriches the student experience to really understand that lived experience perspective. And it's just so important in developing that person-centered care approach, but also producing a really compassionate next generation of professionals.
Yeah. Fantastic. We do have a question that's come through. Somebody who hasn't given their name has asked, how do you think we can help the public to better understand the fact that obesity is not a choice?
That is, well, that's a really, really good, a good question. I think if we can all start to, I think we've got a role to play in really changing the social narrative. If we can start to integrate and work better with media across sort of traditional media, but also social media, I think if we can all start to sing from the same song card, I think we'll start to see a movement in the right direction. I always relate it to other chronic diseases, such as, I always say, sort of comparing it to something like living with osteoarthritis. You know, we wouldn't give somebody who's living with osteoarthritis a treatment for 12 weeks and expect them to be cured. You know, we expect that lifelong pathway of care. And I see obesity as exactly the same in terms of how we manage that chronic disease and that lifelong care required to achieve that.
Thank you for that. I've got a question here, which is around some of the talks that speakers from the Institute have done with Obesity UK support groups. And the person here mentions that they've really enjoyed having speakers from the Institute, but in what ways has this been beneficial to the speakers?
Oh my goodness. I mean, it's been an honour and a privilege going to speak with Obesity UK, but it's been lovely to be able to share kind of insights from our research with the Obesity UK groups. But what's been vitally important has been the opportunity to actually go and actively listen, really understand what are the real pressing needs within with people living with obesity. You know, where do they think we should be shaping our research agenda? And those interactions with Obesity UK have been absolutely pivotal in developing a huge work programme around emotional and disordered eating that we're currently developing. We've now gone to speak to several different support groups, and it doesn't matter sort of what we've gone to talk about, we end up talking about the impact of emotional and disordered eating and the lack of psychological support that's generally available for sort of anyone that's seeking weight management support. So we've developed a very large program of work that will hopefully start to address that really important area. So I'd say it's been absolutely pivotal, and our research program has basically been orientated around those voices that we've heard. So massive thank you.
Yeah, I absolutely agree. I think also we are very much indebted to the work that Ken's been doing with those support groups in building the Obesity Voices Hub. A lot of our membership comes from people who are engaged in those support groups. So yeah, I think that having that really fantastic partnership with Obesity UK has just given us so many more benefits. And again, going back to what you said about making sure we are all singing from the same hymn book. So Nadia Isaac asks a question, and she says, being a champion myself, I am asked by people living with obesity who want to become advocates. So if I signpost to yourselves, would this be a good way?
That will be absolutely fantastic. Yes, definitely. Thank you, Nadia. Please do signpost people. And also for anyone that's interested in membership, if you go along to the Obesity Voices webpage, there's forms that you can sign up. But when you're signed up, or if you want to have a conversation with us beforehand, what we really want to hear is what support do you need? So I've spoken a couple of slides about the traditional and kind of newer training skills that we're hoping to develop, but we also want to hear from our members. So what training and support can we provide you? Because we would, you know, as I mentioned, our members are our partners. We see this very much as a two-way process. So yes, it would be a great way to help with advocacy, but also we'd really like to support you as a member in being a stronger advocate, because the more advocates we have, the better, and the quicker we'll start to actually change the social narrative around obesity.
Fantastic. I have another question around what the Obesity Institute is trying to do to address change in education and continuing professional development and embed and encourage this person-centered approach.
Super. Well, we've got quite a few. So not only are we still trying to embed the lived experience and the person-centered approach into the various different teaching programs that we run across the university, we are also very excited that we should hopefully be starting our new Masters in Obesity in September, all being well. And we're also hopefully going to develop a professional doctorate program as well. Those programs will be really genuinely unique. They have been developed with the voice of lived experience at the core, and they are centered around providing person-centered care, compassionate person-centered care through that training pathway. So yes, so I guess it's multi-pronged. We are feeding through our traditional existing programs, but we also have these really exciting new programs sort of in the imminent future.
Fantastic. And I have another question here around some of our work around the least heard communities. And the question is, which communities do we still need to reach out to, and how might you achieve this?
Oh goodness, lots. So again, working with our fantastic colleagues within Obesity UK, we've identified lots of groups. So the program that we're about to start in April, the NIHR program, so that will be working with South Asian Muslim ladies and the LGBTQ+ community, but we've also identified men, older adults, people living with neurodiversity, people living with physical and learning disabilities, people living with severe and enduring mental illness, and there are more that that I've probably missed off that list. It's just really important, and I think what we need to be doing is going out and working with our communities. I think for too long as researchers we've expected and hoped people would come to us, and that's just not good enough. We need to be going out and actually working, building trust with our broad and diverse communities, really understanding and listening what it is people need, what it is people want, and where the priorities are, and then working together to develop effective research solutions to solve those problems. And I think that's the only way, by actively listening and working in true partnership together, that we'll actually start to get a more fair and equitable evidence base that provides evidence and solutions to support everybody that's in need of care and support.
I guess also in terms of how we've developed the Obesity Voices Hub as well, and encourage the membership of people reflecting those broad and diverse communities, and making that a resource available to our trusted academic partners. I think that's also a really strong mechanism to reinforce and reach out to people. And I think anyone watching this that does represent one of those least heard communities, it would be to say, please come and get involved and join the hub, because your voice is so important.
Yeah, absolutely.
So I have a question from Bal Singh, who says he's specializing in applying machine learning techniques to predict childhood obesity. And he asks how he can get involved with the Institute.
Oh, fantastic. Drop me an email, because we've got a really big growing program of work around complex systems, of which that modelling would fit absolutely perfectly. So I'd say please drop me an email, and that applies to absolutely anybody, irrespective of where you're from. I always say, as long as you share our vision and mission to really make a difference, we would absolutely love to work with you. So please do drop me an email. I think my email should be on the slides. If it isn't, we can circulate it afterwards, but do just drop me an email, because we would love to work with you. And that sounds like that could be an absolute perfect fit with the systems work that we're doing. So please do get in contact.
Fantastic. So I have another question from Nadia, who says she has come off a call regarding a study, but the funding was cut for studies which would have enabled the PPIE element. How do you see yourselves in counteracting these cuts?
Oh my goodness, that is really sad. Well, I think we've got to, I'm hoping, as a really strong collective voice, sort of within the Obesity Institute, working in true partnership with Obesity Voices, you know, we need to be an advocate of the voice of lived experience, and really working closely with our partners within the funding bodies, and also across sort of central and local government, to really drill home the absolute importance of the voice of lived experience. I mean, I really can't tell you how fundamentally important our PPIE members are as members of our research team, and how much they have shaped the work that we do. And we really wouldn't be able to do the work we do without that partnership occurring. And it will be really sad to see sort of funding cuts inhibiting that process. So I think we've got to work together to be a strong voice, to advocate the importance and the real impact of incorporating the voice of lived experience.
Yeah, I absolutely agree. And I think one of the ways in which the Institute are really committed is by publicising and sharing the evidence of the great case studies where PPIE has been done, and it's been done effectively, and it's been done really well, to really make sure we can influence that agenda to demonstrate the value of the voice of lived experience. So yeah, I mean, it's absolutely essential, isn't it, in terms of, because it is a very difficult, I mean, not only is there a cost of living crisis amidst, people participating in research and caring roles and things like that, but also with funding cuts to funding pots, it becomes more and more challenging to support PPIE. But I think as an organisation, we're so committed to the long-term sustainability of the Obesity Voices Hub, and making sure that we made it central to everything, because we realise we can't exist without the community we serve. So yeah, it's a really great question, that.
Yeah. And there are, sorry, Saida, I was going to say there are some pots available. So the NIHR Research Design Service have small pots of funding available to support PPIE activity, which is particularly useful when you're actually developing a grant. And I think you're right, Saida, actually sharing those stories to really illustrate the impact that PPIE has had on the work that we've done. I mean, I'm thinking, for example, the remission study, which is our evaluation of the NHS low-calorie diet programme. We have got the most fantastic group of 7 individuals from representing a really diverse range of the communities that are affected by type 2 diabetes and living with obesity, and they have been absolutely pivotal. We worked with them right from the very sort of conception of the funding application right the way through. They have literally taken part and shaped every stage of the research, even to the point where they're collecting data, they're helping us to interpret finding. They've developed our methods with us. They've developed, they've made films, they've written a paper, they've developed resources, they've helped us develop surveys, patient-facing material. It just would not have been the same study, and it would never have been nearly as good a study without that input. Honestly, they have been absolutely fundamentally critical in that program of research. So yeah, so we need to be shouting about it.
Absolutely. And I think we've also been very good at poaching some of the people on the remission study to inform the Obesity Voices Hub, and many of those members have gone on to be on the PPIE steering committee for the Institute, which again really demonstrates how I think as an organisation we are so inclusive and want to work with not only people with a lived experience of obesity, but other obesity related organisations. And the fact that we've got Obesity UK, the Obesity Empowerment Network, and many other organisations represented on the steering committee, I think is a real testament to us trying to galvanise the community and really support the voice. I have one more question here, which is around whether or not the Institute is doing anything locally to make an impact for children at risk of obesity.
Oh, well, we've done various studies. There's a program of work led by George Sanders that was completed last year, where we were looking at the needs of secondary school age children around weight management support. So there was that piece of work. There's some really fantastic work that we're helping to support, that the West Yorkshire ICB are leading around integrated care pathways for weight management, and we've worked sort of quite closely with several of our kind of local authorities. So there are programs of work also in progress, so we're very interested in the NCMP. So I'm a co-applicant on the MapMe program, which is led by Newcastle University, where we're developing new body scale, or have developed new body scale images, and we're testing those to see if they can have an impact in terms of sort of improving parental recognition of unhealthy body weight and action towards that. So there's that program of work, and we're also just very interested in the impact of measurement on young people and parents, particularly post-COVID, where we know that we've seen an increase in obesity in our children. And we've also seen an increase in concerns around mental health. So I'd be really interested in exploring that further and really understanding and contributing to that move towards a more compassionate, person-centered, holistic approach to weight management, perhaps taking away from that kind of very defined focus on just weight, but thinking more about weight as a factor in more holistic well-being.
Fantastic. I think we're all out of questions now. So it just really leaves me to say thank you, Louisa, for not only speaking to us about what's happening in the Institute in terms of the person-centered approach, but also just for your passion. I know that, you know, working with you, you are so passionate about it, and it is very much, you know, sort of everybody's experience. You are such a, you know, you really do advocate for people with a lived experience, and it just shines through in all of the conversations and projects that we work with you on.
Thanks,
So-
Ada. I mean, it's a great honour and a privilege. I mean, I always say my job is not a job, it's a vocation. And I'm very privileged to work with such a fantastic team and just such fantastic colleagues and members of our Obesity Voices community. So the privilege is all mine.
Fantastic. So I'll just close off now with just another nod. If you are interested in coming along to other seminars, there will be more information on our website. They'll all be advertised via our social media platforms. We're on Twitter, Facebook and LinkedIn. So it's at Obesity Inst, and you'll be able to receive a whole schedule, because we do have, when we went out for calls for seminar topics, we were absolutely inundated. So we do have them all planned for the next year as we go through the year. So yeah, thank you very much, and keep following us, keep posted on what we're up to.
Thanks, Ada.
Thank you. Bye, everyone.
Bye, everyone, and thank you.